Since the beginning of lockdown, UJ and the HSRC have been running the Covid-19 democracy survey. And this survey has conducted many rounds with the intention of picking up on what issues are important at particular moments in time. So as we fielded our latest round of the survey in December and into January, obviously, vaccines were going to be a very, very important question. So we included the question about the willingness to vaccinate, but also to find out why people do and do not want to vaccinate. So this is quite exciting findings.
And take us through those findings. Were most people willing to vaccinate or not?
So it's very, very pleasing. 67% of people say that they are willing to vaccinate. This is obviously very close to the kind of figure that we need for the so-called herd immunity. Of course, we were only surveying adults, and it's 67% of the population, including children, that need to be vaccinated in order for us to have that herd immunity. But still, 67% of adults saying that they are willing to be vaccinated is very, very pleasing. A further 18% said that they did not want to vaccinate, and a further 15% said that they weren't sure if they wanted to vaccinate. So overall, 2/3 are saying that they want to vaccinate, but that still does leave a third that is either unsure or saying that they do not want to vaccinate at this time.
And what were the reasons for the uncertainty? I mean, we are really at an era where there are lots of reasons that people are giving for not wanting to vaccinate. What did your survey discover?
So what we found was the biggest concern amongst those who were either unsure or did not want to vaccinate was concerns around side effects, concerns around the effectiveness of the vaccine, and particularly concerns around the testing and concerns about the speed at which the vaccine has been rolled out, and also people simply wanting more information about the vaccine in order to make a decision on whether they should vaccinate or not. We found only a very, very small proportion, less than 10% of people giving some kind of conspiracy-related theory, for instance, like the 5G conspiracy theory. So I think what this shows is for those who are uncertain about vaccination, they largely have legitimate concerns about side effects and effectiveness. And this highlights the need for public health campaigns that provide this kind of information to people so that they are reassured and feel that they can take an informed decision about vaccination.
And as far as the spread, the demographics, male, female, age, gender, socioeconomic standing, those who were more willing to take the vaccine, where did they fall juxtaposed to those who were either unsure or not willing?
So what was interesting was gender only played a very small role. So there wasn't huge differences between men and women. Where we did see more interesting polarization was around education. So those with less than matric qualifications were much more likely to want to vaccinate than those with a tertiary education. And I think this might go away a little bit against expectations. So it's a very interesting finding in terms of who is more likely to be vaccine hesitant. What we also found was that Black African people are much more likely to want to vaccinate in comparison to white adults. So again, this is a very, very interesting finding.
And why would that be?
What we also found was that there was also a relationship to people's views on President Ramaphosa's handling of the pandemic. So those who were more likely to say that they thought President Ramaphosa was doing a good job or the national government was doing a good job were much more willing to vaccinate than those who thought he was doing a bad job or the national government was doing a bad job. So I think this partly we can see in terms of the demographics when we think about maybe particularly race and age. Again, younger people were slightly more hesitant to vaccinate than older people. So I think what we see there is the things like institutional trust and also political discontent as well, interacting with these demographic factors. Another interesting finding that we found was those who say that if there was an election tomorrow and they would choose not to vote were again much less likely to want to vaccinate than those who indicated that they would vote. So again, I think this is showing the importance of political disillusionment and institutional trust in shaping people's willingness to vaccinate.
That's quite interesting. So political considerations seem to be quite paramount when people are making decisions about trustworthiness of the vaccine and considering their own health. But if you could, Professor, perhaps juxtapose South Africa's reactions to global studies and global results. We at 64% said they would take the jab. How do we compare internationally?
So we're definitely ahead of many other countries. I mean, notably, we're much further ahead in vaccine acceptance than a country like France, where it's almost less than 50%. But we're sort of on the borderline of the kind of levels of vaccine acceptance that we need. So as I was saying, 67% currently say that they are willing to vaccinate, but that's only adults. So in order to get that herd immunity where we need 67% of the population, not just adults, we do need to increase the levels of vaccine acceptance amongst adults if we are going to overcome the pandemic. And I think what the findings from the survey show is the public's need for reassurance and education around vaccines.
Well, thank you so much, Professor. And I guess that is the value of a research such as this. It not only gives you the numbers, but it also gives you the reasons why people are making the choices that they make, and also possibly where the interventions may come in. A greater education, as you say, will go a long way in easing people's minds and also feeling a sense of trust in the leadership. Interesting that less education people have, the more willing they are to take the jab, according to your research. But thank you so much for those insights.